Hello again, dedicated psych students. We have looked a little bit about memory and its natural decline. But what about when natural processes are interrupted in some way? In this video, we're looking at the impact of brain trauma, brain injury, and dementia. Firstly, let's look at amnesia. Amnesia refers to the partial or complete loss of memory due to brain injury or trauma. Brain trauma may be the result of a bad injury or accident, disease, stroke, alcohol abuse, or a range of other factors. There are two main types of amnesia that we want to look at here: retrograde amnesia and anterograde amnesia, plus infantile amnesia. Before we start, let's make something extremely clear. Retrograde and anterograde amnesia are often confused. So to help us remember which is which, we can use a mnemonic device. In this case, that mnemonic device is ROAN, kind of like grown except without the G. It stands for retrograde equals old, anterograde equals new. And if that doesn't do it for you, feel free to make up a mnemonic device of your own. Now, let's try to work out what ROAN actually means. Retrograde amnesia results in difficulty in retrieving previously stored information. Let's say that there is a man suffering from retrograde amnesia. Let's call him Roger. Roger has retrograde amnesia because he suffered a brain trauma from a significant stroke. Now, because retrograde amnesia affects old memories, Roger struggles to remember anything from before his stroke. But retrograde amnesia doesn't affect the ability to form new memories. So Roger may not be able to remember the name of his niece, who was born 2 weeks before his stroke, but he is able to form new memories after his stroke. So remember, retrograde amnesia affects old memories. Anterograde amnesia, on the other hand, results in difficulty in encoding new information, that is, forming new memories. Let's say that Abby suffers from anterograde amnesia. Because anterograde doesn't affect the retrieval of old information, Abby is still able to recall information from her childhood, but she struggles to remember anything from after she started suffering from anterograde amnesia. So remember, anterograde amnesia affects new memories. With this information, we can try to answer a practice question. This one is from the 2012 VCE exam. We have a case study here, which reads, Peter is a healthy 56-year-old man. He rode his bicycle to work and had an accident in which he sustained a head injury that affected his memory, but which did not affect his speech or motor functions. Although Peter regained consciousness soon after the accident, he is unable to recall any of the events that have occurred since the accident. However, Peter still retains all his memories of his life before the accident, and he can still recall the events leading up to the accident. And the question is, Peter's pattern of memory loss is typical of A. Alzheimer's disease, B. Retrograde amnesia, C. Anterograde amnesia, or D. Age-related memory decline. This sounds extremely like amnesia, so option B or C. But which one is it? This is precisely the time that we can put our mnemonic device to good use. So remember, we're thinking of ROAN. In this case, Peter has difficulty forming new memories, so the correct response is anterograde amnesia, option C. Now, one of the options in that multiple choice was Alzheimer's disease, and that is a good segue into another potential reason for memory loss. Alzheimer's disease is the most common form of dementia, which is a neurodegenerative disease. This just means that the nervous system degenerates, gets worse over time. Dementia has become so prevalent in recent times that it was added as the 9th National Health Priority Area in 2012. Remember, retrograde amnesia affects old memories and anterograde amnesia affects new memories. ROAN. Keep working hard and have a psychedelic day.